Um, can you hear me?
Yeah,
we're interested, bro.
Yeah.
We're interested.
Okay. And so
you sound perfect.
okay, so then
sexy AF, dude. Everything you're saying.
so
Hey, we don't interrupt, bro. You caught our attention.
Oh, yeah. I'm over
He's
here.
probably
just
like, why aren't they interrupting? This is weird.
yeah, I was like, they've been talking this whole
They're never
time.
this polite.
I haven't taken a drink.
So I'll take care of you. I back what I do and I back my products because I do the best for people. I didn't get into this to make more money, although I am making more money than I was before. But my goal was never to make more money. It's to help people. And that's really why I got into this.
And
You
if
can
you
do
could do
both.
both,
Why not, right? People get better.
Hey, two efforts. It's Thursday. We're back. Dr. Edwin Serrano is here with us still, and we're going too hard, too fast.
Yeah, again.
Welcome back.
Welcome back.
Welcome to Too Hard, Too Fast.
Too hard, too fast.
Too hard, too fast.
Too hard, too fast.
Welcome to Too Hard, Too Fast. My OnlyFans page is
The podcast of the century.
Right, bro. Let's get into you being a doctor, bro. So let's hear about what you studied for your doctoral program, bro. What inspired you to do it? And then let's get into it.
So I graduated from Marley Lake in 2012. And then I went to UIW and got my doctorate in physical therapy. And I graduated there from 2015.
Okay, that was way too quick. What did you just say?
¿Qué dijo?
Because that makes no sense. No sense.
So I graduated from
undergrad to doctorate.
Yeah, bro.
Yeah, so I graduated in 2012 with my undergrad, and then I went into PT school that same year, and got my doctorate in physical therapy by 2015.
Is that a normal thing where somebody does his undergrad, and then all of a sudden he's like, "Oh, master's"? Because usually it's like undergrad, master's, doctorate.
Master's, doctorate.
Depends
It's
on
so it can be like it's a clinical doctorate, right? It's like someone going to undergrad and then like going to dental school or going to optometry school. So it's the same concept. Some people go the master's route because not everybody gets in right away. I was pretty fortunate to get in.
Stone.
I think like my experience in undergrad, studying abroad, and like doing different things helped me kind of get accepted. And then I did, to get into PT school, you have to take more courses than just like a regular degree plan most of the time. So I did a lot of summer school throughout the 4 years, so I had all the prerequisites for it, and it was really like 5 years to complete my undergrad. So when I did that, then I went to PT school like right off the bat. UIW was the only school to accept me, and I could have waited because I think I wanted to go like to Florida for PT school, but I didn't want to wait a whole year and hope that I get accepted somewhere. So I kind of just went to school at UIW because of that. And then
I don't know if Worm asked this, and I'm gonna apologize if he did. If he did ask this, I wasn't paying attention. Did you always want to be a PT?
No, I kind of fell into it. I didn't.
This is too hard, too fast, and we don't check. Did you always want to be a PT?
No, like I honestly never really wanted to. Not that I didn't want to. I didn't know what I wanted to be. I kind of like I came back from Italy. I had 1 semester left, and I was like, oh shit, I need to do an internship to graduate. So you can't hear me?
What were you doing in your college life this whole time? What were you majoring in? Did we miss this whole thing? We just go too hard, too fast on everything.
Too hard, too fast.
We should have investigated.
We went too hard, too fast in the wrong direction, bro. That's what we did.
Too hard, too fast.
Because
too hard, too fast.
Too hard, too fast was in UTEP, bro. Hey, would you say UTEP was a too hard, too fast life? Right? Drink and drown.
For a little bit. Okay. What was your major when you did UTEP?
So my major was at first engineering, and then I changed it to kinesiology.
Did you say that to us before I asked this question?
No.
Okay, good. We're on the right direction.
Yeah.
when you went to Our Lady of the Lake University, what was your major then?
It was
You just said
kinesiology.
it.
You said it? Did I miss that?
No. So I was an engineering major at UTEP, changed to kinesiology, and then kept kinesiology when I went to LA Lake.
Okay, so I just like only heard the first part when you said it.
Mm-hmm.
Fair enough. So kinesiology.
Mm-hmm.
At what point did you decide that you were going to do PT? PT, physical therapy for people that are like,
Personal training.
Substance abuse.
Personal training. No. So I didn't know. So I was going to graduate, and I had one semester left. And I always said I was going to be a basketball coach, but I was like, man, I can't be a basketball coach. Like, I like it, but I was like, I want to do something else. So I had to do an internship. I interned. I did like 100 hours of like at a physical therapy clinic, and I was like, oh, this is something I could do. Like, why not? And so I did apply for physical therapy school because I was like working at the Y. I remember at that point, like my senior year, I was like, man, I need to go I was like, I need to do something else. Like all I know is school at this point. So I applied and see if I would get accepted. I got an internship, and then like when I was going to graduate, I got an acceptance letter, and I was like, guess I'm going to PT school. Like I was like, well, I could see myself doing this. I always said like I can't play professional basketball or be in it, but maybe I can be around athletes. So that's kind of like where my mentality went, is like if I can't be a player, if I can't make money, I have to be around them somehow. I also applied to be like an athletic trainer, I think, but PT, I got accepted to PT school, and I went with that.
Nice, bro. So during your doctoral program, because you were strongly interested in it, was it I mean, difficult, or I mean, of course it was difficult, I guess, but what were your biggest challenges? I guess that's what.
So the biggest challenge was I was part of the inaugural class. So I was part of the inaugural class, and then it was a different take on learning and a different take on teaching. So it was problem-based learning. So where you go to a classroom and they like, oh, this is what your learning objectives are, and here are your textbooks, find your answers. And they would literally answer your question with a question. Like, hey, like, how do I like find this, muscle? It's like, well, how do you find this muscle, Edwin? Like no, really, like
you to tell me.
So in all actuality, like we were the guinea pigs for a new way of learning for physical therapy, and our passer rating was terrible. Like 50% of the class passed the license exam. Wow. I was one of the 50%.
That's what's up.
But it was like a different take on learning and a different take on doing it, and I was like, oh my god, like a lot of people failed. They all eventually became PTs. We all became PTs. But it was definitely a learning curve for us and the professors. Like we were not given like the education that we probably should have had at first. They've changed the program. It's a lot better now, but that's what we went through.
But you know what? At the same time, I think you probably learn more on the job.
Oh yeah. Like even our dean said it when we were in school. Is like you're gonna learn 10% through these 3 years of what you're gonna use throughout your whole career. Like 10%. Like that's all you're gonna know. You're gonna know the basics. You learn how not to kill someone, and then you go learn on your
own. That's good to know.
Never mind. I don't know about that. Maybe please learn not to kill me. Because when I was saying what I was saying, I was like thinking, I learned a lot about special needs and different, and disabilities. I have learned more by being on the job and how I can with certain kids. But at the same time, I don't want to die. So Edwin,
por favor,
Dr. Edwin.
I mean,
my
but you're right.
Only like, goes one way.
Well, quit bending over.
I'm gonna have to.
Hey, so being part of that first class, was it difficult then getting a job or transitioning into your career, or it didn't really matter because you got your license?
No, I mean whenever you're going through that, you you get like internships or like rotations, clinical rotations, and you kind of like go to different settings, like you'll work in a hospital or you're working in an outpatient. Like, where do you want to work? What do you want to do? And then like, I mean, everybody's always hurt, so there's always a job, you know.
Yeah,
There's
that's true.
always something there. So I went to go work for a company that had it was actually the company I interned with, and then it was a company that I did a clinical rotation with. I was like, oh, it's a good company. I can see myself working here. And so when I graduated, I went to work for them.
Nice. So where are you at now?
So me and my wife started our own company for physical therapy. So we are seeing patients in Southtown, San Antonio, and we started it in January. It was kind of just like a thing, like, oh, maybe we should do our own thing, and then it's just like kind of like how, oh, I should leave San Antonio, and like I just drove, like, just kind of like how it happened.
So stop being modest and tell us what it's called.
So it's called
Advertise, bro.
So it's called Positive Action Rehab and Performance.
You're wearing the
so
shirt.
Yeah.
Let's see it, bro. Damn, that's what's up.
So
Positive
if you can see the logo, you can see that it's weights at the top, and then you can see, so it's after, you would appreciate this one, it's after the Vitruvian Man, art in Italy. So was it Michelangelo? Yeah. So so the logo's after that because they did a lot early on to find the anatomy of the human body, and they were like doing it in secret, cutting up bodies to find out the anatomy of the body and trying it out. So that's kind of like responsible for our sketches now of how we study the body. So that's why it's a logo of that. Mm-hmm.
So is that like a shirt you can send me so I can wear at work, or?
Let me know and I'll get you a couple shirts.
Just let me know your sizes. Fatty.
A what?
Fatty. I mean, extra large.
Extra
Man,
large.
dude, so
all right.
You said you started in January, right? This past January?
Mm-hmm.
Dang, dude. Okay, so how were your first 2 months? And then, dang, dude, of course, how did you have to adjust with this whole
first 2 months?
Yeah.
Obviously.
Yeah, so I think I got to get into the practice and how it functions. So
get into
the practice isn't it's not insurance based, so I don't take insurance. I don't whatsoever. And people, when I was first starting, were like, how can you not take insurance? Like, I'm not gonna go see you. Like, if you don't take my insurance, like, there's no way I'm gonna see you, right? Basically, I had worked 5 years for another company, and I was getting burnt out. So during those 5 years of working for another company, I went through a fellowship training. So I still went to school after my doctorate, and got more additional training and like a specialty. It's called a fellowship. And so from there, this company I worked for, they said, hey, like, we'll pay for your fellowship if you commit to 3 years after you're done with your school. So I had to work for them during going to school, which was weekends, driving to Austin or San Marcos. And at the same time, whenever we're done with our fellowship classes, we have to do like 440 hours of mentorship hours. So we have to be under a fellow to really get that training, and then you get like a fellowship, right? So in order for me to become a fellow, I had to work 4 10-hour shifts. So I was working like Monday, Tuesday, Thursday, Friday, 7 to 6 at my clinic, because I was a clinical director. So I ran a clinic, I grew it in Floresville. And so on Wednesdays, I would go for a whole year, once a week, and go work at another clinic for free to get my fellowship hours, right? So whenever, and so last August, so about a year ago, I was finishing my hours, and I already been a director for like 2 years at this clinic. I grew it, and I was busting my ass, and I said, like, what's next? Like, I said, like, in order to effectively see my patients in the clinic that I have now, I was like, I need to keep my 10-hour shifts, because people come in the morning or they come after work. Like, there's no way. And I have another therapist that does the same thing, but he works when I'm not there on Wednesdays, he's there on Wednesdays, type of thing. And he has like another day off, like on a Thursday or something, So it came down to, like, I was finishing up and I was like listening to podcasts, speaking of which, about like starting your own business and like where PT was heading. And so PT, if I ask people, they don't know what it is. They're like, oh, you just give me exercises, I do them, I get better. But there's like so much more complexity. but at the same time, people don't know how to PT correctly. Like there's people in our profession that don't know how to get people better. It's just like, oh, you have ankle pain, you're gonna do the same 4 exercises. You have back pain, you do the same exercises the last guy did. Um, and so, me and my wife started talking, and we're like, what can we do, or what can we do to, like, on Wednesdays, like, just to do something on the side. And so I kind of started like a little side hustle. Like I just did like a little sole proprietorship, like see people on the side, that's if they come in or whatever, like seeing at gyms or whatever. And slowly, like my wife can talk to a wall, so she can market to anybody and everyone. And we walked into a spot and they had a space for rent, and we said, oh, like, why not like rent it and see what happens, um, can you hear me?
Yeah. We're interested, bro.
Yeah.
We're interested.
Okay. And so
you sound perfect.
Okay, so then
AF, dude. Everything you're saying.
so
Hey, we don't interrupt, bro. You caught our attention.
Oh, yeah. I'm over
He's
here.
probably
just
like, why aren't they interrupting? This is weird.
yeah, I was like, they've been talking this whole
They're never
time.
this polite.
I haven't taken a drink.
So basically, it was kind of like the thing, like how I talked to you about earlier, like, oh, when I went to Italy, it was like, oh, apply, oh, see what happens, oh, get accepted, oh, this and that, one step at a time. And so in January, it turned out that I was seeing people on Wednesdays on my day off, and I still get this, like, I still have 3-year contracts, and I had to ask for permission because I was a director to work for myself. Like I was like, oh, just see people on the side, make some extra money. And so then before I knew it, I was working on Wednesdays 7 to 7, right? And without insurance, not taking insurance, just helping people. And then it turned into me like driving in from Floresville, getting home at 6, and I had patients at 7 and 8, and not getting home till 9. So then I was like, okay, like I'm at a point where I'm making my income that I was making before, just working on a Wednesday, a Saturday, and like afternoons, So I was like, why can't I do this for myself?
That's legit.
As I mentioned earlier, like I worked for someone else and I grew their clinic, and I was just their workhorse. So why couldn't I do it for myself?
Yeah.
And at the same time, by taking insurance, I was seeing like 17 to 20 people a day. Like, I don't know if you've had physical therapy, but physical therapy has turned into like a mill, right? Where you come in, you see a physical therapist for like 15 minutes, and then they hand you off to someone else. And before you know it, like you're not getting specific care. Like, Joaquin, you've torn your ACL, your meniscus, you did that, but how specific was your care really, right?
Yeah, you're right, dude. I would just see him. He would check my knee. All right. And then he would hand me off to someone, and then basic exercises. I'm like, really?
Yeah. And it turns into, and it's not their fault, and it's not a doctor's fault. It's nobody's fault. It's really the insurance's fault. It's your insurance's fault that this happens, right? Because a physical therapist has what you call like a conditional, like a contractual agreement, or the company has a contractual agreement with your insurance. So let's say like I see you for an hour, or you're there for PT for an hour, and I'm billing $240, right? To you, you're like, fool, you're like getting $240 off of me for an hour. In reality, the insurance only reimburses 30% of that, right? So the insurance is reimbursing 30% of 240, which whatever that is, like let's say it's $70 if we're lucky, right? So we're reimbursing $70. Well, let's say your copay is already $55. Those $55 goes to the reimbursement your insurance is paying. So the insurance only pays $15. Right?
What the hell, dude? Yeah.
Yeah. So that's kind of how it works. So at the same time, a physical therapist has to see so many people to keep the doors open and to pay their salary. And we don't make a lot of money. Like as physical therapists, as doctors, we don't make money. Like, and I mean, like starting after at a PT school, I was making like $61,000. It's not like, for having a doctorate, like that's not a lot of money.
Yeah. Well, that's not taking into consideration your student loans and all the debt you have, right?
Exactly. So you have a lot of debt. You can't. I mean, you're thinking about like, okay, you're making this much money, but you can't even, like, I don't even have a house, bro. Like, and so it comes down to like your insurance is like screwing both you and I, because they're not allowing you to get the proper treatment, and they're not allowing me to give you proper treatment and and have a decent lifestyle, right? So I
So
went off of that.
how are you able to say I'm not gonna take insurance, still have clients? And
Hmm.
because to me, if they're not taking insurance, it's back end stuff. They're not gonna help me with anything. How does that work? Like how do I make you trust me? Or
So
how do I trust you?
how do you trust me?
Yeah, bro. Hey,
I
how
think you've
do
had
I
a little bit
make
too many
you trust
sellers.
me?
How do I make you trust me? I don't know, man.
I mean,
So that you
So
can accept my insurance, bro. If you trust me, I'll give you my insurance.
how do
um,
I trust you that you're
mhm.
gonna do the right thing for me?
So I mean, obviously, it's getting people in the door. At the end of the day, like, there's no, unfortunately, like, if you have back pain, like, what do you think of first? Like, who are you gonna go to if you have back pain?
Ghostbusters. I don't know.
A chiropractor, right? Like
Yeah,
everybody always
correct.
says, "Oh, my back hurts. I'm gonna go to a chiropractor," right? Like
Yeah.
Oh
that's the
no,
easiest.
100%. Okay, maybe most people. Me, just like I'm just gonna deal with it.
Yeah, yeah, yeah. So,
Yeah,
but
that's
mostly that's what people think, right? Like
Like a
chiropractors have like
banana.
done, yeah. So they've done a good job of like marketing themselves and be like, "Oh, crack, snap, and like your back is fixed," type of thing, right? But I tell people like, so this is how I kind of sell what I do because people are like, "Oh, you don't take insurance," and usually sometimes I get a kickback, and then sometimes I don't. But usually when I get people that are looking for me, it's word of mouth. I don't get people from like, oh, like I saw your post or I saw this. It's usually like, hey, they told me you were good. Can I come see you? And then I tell them the cost, and they're like, that's fine, you know. But the way I get people in the door usually is I do a free evaluation. If I didn't believe in my product, I wouldn't evaluate you for free, you know.
nice.
So I tell you like, hey, come in here. Look, I charge this much, but I'll do the evaluation for free, which is 30 minutes. So I evaluate you for free. Is it's a shoulder injury, neck, whatever. And then what I do is I see you for 30 minutes. I
Mm.
tell you what it is. I tell you how I can help you. And I straight up tell them whether I call on the phone or it's usually on the phone. Don't, I talk to everybody that comes to the door. Nobody else talks to them. I don't have anything else. I make sure that I listen to a patient and really hear them out because at one point in any healthcare setting, people are not heard. You're
Damn.
not heard. Like when you get a call from a doctor's office, you never talk to the doctor. It's rarely you see the doctor. So when a doctor calls you and they say, I got a referral, you never get a call from the doctor's office. You get a call from their front desk. They don't
Mm.
listen to what's wrong with you. They know your back hurts. Okay, cool. Like set up a time and day. And then when you set up a time and day, then you're like, okay, like you show up and you already have like this mindset like PT's not going to help me. Like why the F am I here? Like my doctor, my chiropractor, my everybody else up to this point could not help me. Like, what are you gonna do? Like, we're always like the last lifeline. Like, no one thinks about us as a primary healthcare provider. Like, like if your back hurts, you don't think of coming to me first, right? Like that's
Well,
something that I want to change because I can help people right off the bat.
well, I think a big issue going off that. I think a big issue is you can't go straight to that because sometimes if you do call a physical therapy place, they'll be, well, do you have a referral? No, and they'll tell you, well,
Hmm.
go talk to your primary doctor first. It's like, damn it, like I already know what's wrong with me, but no, I
Yeah.
still have to go to the doctor, and then I have to pay a copay, and then
Hmm.
still, okay, fine, can I get a referral? And you're
Yeah.
right, sometimes they don't even listen, and they'll
Yeah.
recommend maybe a chiropractor or a
Oh
massage
no,
therapist.
or what they'll do is like come in and we'll give you an injection, give you some Motrin,
Mm,
right? Like
yeah.
like so you end up in this cycle. So like let's say you go to a doctor's office, your back hurts because you want a referral for PT. So then what ends up happening is, okay, well here's some Motrin, right? Here's some ibuprofen. They tell you just rest. So that's the worst thing to do for back pain, by the way. If you rest, that's the worst thing. You need to keep moving. Anyway, so then like 6 weeks pass by, right? 6 weeks go by. You call the doctor's like, hey, I need to come in. Like my back's still not good. It's still hurting. You go in. It's like, okay, like let's do some injections. 6 weeks pass by. They do, oh well, my back still hurts. Okay, let's get an X-ray. X-ray's not gonna find shit. You're not gonna do anything wrong. Like
Because you
if
didn't bring
there's nothing.
bones, it's all tissue, right?
No, like at the end of the day. So I mean, we can get into studies on this or whatever, but a lot of imaging, I mean, it tells you like how our body's aging. It's not going to tell you what's really going on. So for someone to see what's really going on with your pain, they need to see you move. They need to see you squat. They need to see like how your range of motion is. at the end of the day, like one of my favorite quotes is, "It's how we do what we do." If you're sitting on your ass all day and your back is hurting, get off your ass. You know, like it's how you're doing everything that you're doing up to that point. And that sounds like simplistic, but at the end of the day, like you have to look at where are deficiencies, where are imbalances, and people are never assessed that way. We're assessed as like, let me take a picture of your spine. Oh, you have arthritis in your spine. You know, like arthritis is like gray hair. We're all gonna get it. Like that's what it is. But is that the root cause of your pain? No, but that's what they see in imaging. So that's what I'm gonna tell you you have because I can't fix you.
Yeah. Or would you
know?
say a lot of times healthcare, they're just trying to address the symptoms and, like you said, not the root cause?
Yeah,
They're just,
I mean, if you get kind of deep into it, you can kind of follow the money, right? Why is insurance or whatever doesn't improve PT, or why they pay less? Obviously, you get reimbursed more if you take more meds, if you go through surgery, if you go through this. That's where the moneymaker is, right? Like a total knee replacement, 100K, right? Like a doctor's gonna make $100,000 off of a total knee replacement rather than sending you to me.
Yeah.
You know?
Definitely. No, I totally agree, man.
Yeah. And not everybody's like that. I'm not gonna say, but it's something in our healthcare field that needs to change. So there's a lot of therapists that kind of doing what I'm doing, the cash-based thing, and going back to what I do and how I sell what I do is like I give a free evaluation. I call them. I don't email them. I don't text them. I call them.
Nice.
Like once they inquire, and I talk to them for at least 10 to 15 minutes. Once I talk to them, I tell them, this is what we're going to do. This is how I do it. I give you free eval. If you don't believe in a product, and I tell them, if you don't believe in what I can do for you and you think I'm full of, you can leave. You can walk out and you don't pay anything. All you did was waste a little bit of time, you know? And to this day, like no one's really walked out.
Wow.
Because no one will ever look at a patient the way I've looked at them, because no one really assesses people the way they should. And to me, it's very simple to really find out what's going on with people. But to a lot of people, it's just like, if you're in an insurance-based practice, they're going to will and deal. How many people can we get in? How many people can you see? Because reimbursement rates are low. The more people you see, the more money we make.
Yeah, no, definitely. Yeah, what I love what you said, bro, is because I remember listening like some doctors where you could go to 3 different doctors and each doctor diagnoses you with something different because they didn't take the time to listen. They're just listening to your symptoms, and then they all fill in assumptions, and then that's why they all come up with different conclusions and stuff. So that's why I love that you said you actually take the time and listen and all that. So let's just take a hypothetical.
Before you keep going, you know what I love, as you were saying that, is that where you were playing that perfect compliment to how Edwin is as a great doctor. He was doing this.
Hell yeah, dude. Hell yeah. That's what's up, dude.
And that's why we love him.
Hell yeah, bro. Hell yeah, bro. That makes me proud.
That's funny. Yeah, I didn't realize it. See, y'all have me drinking.
No, that's
You're drinking, bro.
And I don't think, if anybody's listening to this and saying, I don't want to go to that doctor who is drinking on the podcast. Like, you know what? You know what you have told me? No. You know what?
I'm the drunk one.
Shut up. No.
Hell.
Let me talk. No. You know what?
So when I was... Go ahead.
What Edwin has shown me this whole time is like he knows his stuff. He knows what he studied. Right. He knows what he's working. He knows his livelihood. Like I really, dude. When I met you, you were younger, obviously.
Yeah.
No. Hey.
When I met you, I was younger.
It was like it was a different maturity.
Yeah, dude. When I knew you,
the Edwin I met is not the Edwin I know now. I know you. We all do dumb stuff in our own private lives. We all do things. But the Edwin I met is not the doctor I know. Seriously, this guy's a doctor. He knows his stuff, and he wants good for people. So that's what I was listening to. Like this whole time, I probably won't remember how good you can do things for people. What I will remember is how much you care. And I'm always gonna remember that.
I thought you were gonna say, George. One thing I won't remember this, but I thought you were gonna say that because you sound drunk. You sound drunk. So I'm like, well, yeah, I wouldn't doubt it.
Well, then you know what? I'm gonna cut this whole podcast out. Then.
No. Hey.
The thing to me is like I've had to go to PT because of a back injury. And I get it. Like
I remember you texted me about it and you never came to the school.
No. You offer some weird backhand stuff.
Hello.
At the time, you weren't established. You weren't established. So I know where
you weren't in network, bro. You were out of network.
I wasn't in network. You're out of network. I'm not gonna do it. Yeah.
I know where you work out. No. That's not the thing. But I'm saying, like, okay, I've done PT stuff, and I hated it, dude. I hated it so much because I really it was like, do this move, do this, and it doesn't. To me, it didn't feel like it helped. It wasn't. Yeah, and you explained it earlier. Like, it just feels like it was like I was just getting passed through.
Yeah, like, and it's just repetitive. Like, it's
for time. If you were a doctor, and if you were my doctor, maybe my back would have been better.
Hey, George, you could still go, bro. It's open for business. So.
Can I? Can my back?
You don't need a doctor referral, bro. Or you know what?
Yeah,
hey, doctor, can you refer him to yourself? I'll refer you.
Hey, my back's still messed up. We'll talk about it. All fair.
Hey, you know what? That would be a good example, George. If you want, let him diagnose you. Then we could sue him. No, I'm just joking.
You want to see my back? You want to see my back?
I mean, you have to advocate for yourself, and that's the thing that I'm trying to get to is like people need to be more informed. Like people, like you thought PT was up until this point, you probably thought physical therapy was that. Like your experience with PT was that, and it was terrible, and it's never going to help you.
So people who have had bad experiences, they'll have a whole different experience with you though, because we'll actually address maybe the root cause as opposed to just basic cookie cutter stuff. Or just addressing symptoms then, right?
Yeah, so that's the big difference is like, I guess, the time with them spent. I mean, every patient I see is for an hour, and it's an hour one-on-one with me. Like, there's no one helping, there's no one there, and it's really getting down to nitty-gritty. And when you talk about people like not wanting to get better, it's not that they don't want to get better, but you've been told so many things up to the point that you see a physical therapist. Like, you get told something by a doctor, then you go see someone else, you get told something else. And by the time you get, it's 6 months to a year down the road and you've had chronic pain for such a long time, spent so much money, like, why do you think a physical therapist is going to help you? Like at that point, you're thinking, like, there's no way this guy right here is going to help me. Like, he's like, I'm here because my doctor wants me here. Like, that's the mentality you would get in that kind of setting. And I was frankly tired of it. Like, I was just like, I was more motivated to get them better than they were motivated to get themselves better. And physical therapy, I tell people, I'm like a psychologist. Like, I have to be able to tell you, like, what you're able to do and, like, how we're going to get there. And you have to trust me. Like, I have to say that over and over and over again. If you do what I tell you, you'll get better. So going back to, like, the insurance versus insurance space, like, we talk about how much time and everything. But, like, going to, like, typically when I see people about once a week. Okay. That's all I see them for, right? But these people are more invested. They want to get better because they're paying up front. They're paying, I do a free eval, but if they want to be seen, it's $100 right now. I'm charging, it's $150 for an evaluation, and then it's $127 for every return visit. But if you think about it, if you go to a regular physical therapy place, that you're paying $50 copay, the cost is the same. Now, though, you're getting more of an individualized program, right? So what I do is I see a person for a whole hour. I'm, like, constantly in communication with them, which you're never in a communication with someone you see at the other kind of setting. And I make sure that we do everything we need to do. I send them their exercises, tell them, hey, this is my number. If you need something, text me. If you're hurting, don't wait till I see you next week. Text me. If we need to change an exercise, if we need to change your activity level, let's do it. A big thing that I don't do is, I get weightlifters, I get runners, I get all of that. People typically go see a healthcare provider, whatever they are, and they say, it hurts when I run. What is the first thing they tell you to do? Stop running. Well, you're telling someone that runs for a living and and trains, and that's their livelihood, like not even their livelihood, that's just like their way to get away, and you're telling them to stop doing what they love. Or you have a CrossFitter and you're like, oh, CrossFit's bad for you because their ankle hurts, right? Well, why don't you take your time as a healthcare provider and assess why their ankle really hurts and really fix them? You know, so people are, so my type of practice, it never limits your physical activity. You're never taken away from the things you love. It's experimental on the way, like 1 visit a week. Hey, this didn't work. What will you do this week? Let's change up how much you're running. Let's change up how much your routine is, how many times a week you're running. Let's change up your weekly mileage. Let's check the terrain. Are you running on concrete? Well, let's go change and let's run like on trails now and see what's going on. And before you know it, like it's just a very distinct plan to you because I'm listening to you and your issues. And like, I kid you not, like I have a runner right now that had a stress fracture, couldn't get back to running in the past year. I got her back to running 30 minutes straight without pain in 2 months.
Wow.
But I took the time to see her and to change things up for her. Like, what is a proper way to get you back to running? You know, and same thing for weightlifters. Like, hey, it hurts when I have like weight overhead, blah, blah. This is what's going on. My shoulder, my rib, and if you really diagnose and look at any asymmetries, any muscle imbalances, people get better. But people don't take the time to really diagnose and really look at people. And that's something that I do and something that I dedicate myself to because our healthcare system is so broken.
Yeah. Wow, that's so whatever they're paying for, it goes way beyond that one session, man. It goes, I mean, it goes to you communicating with them constantly. It goes to, like you said, that personalization. It goes to even have direct access to you and everything, then, right? Man, that's awesome.
Yeah, and the other thing too is like, you know, you've been through it, Joaquin, but like an ACL injury, like I bet you tore your ACL, your insurance was paying for it. At some point, they stopped paying. They're like, oh, you can't go to PT anymore.
I forgot how many sessions. They said, hey, only up to this, and that's it.
Yeah, and you know, for an ACL injury, you need 10 months. Like research has shown, you need 10 months of rehab, and that is like getting you back to running, playing, whatever it is, and it takes you 10 months, and then insurance will cut you off at 3-4 months. Or you have to start spreading out the visits, and you spread out the visits, but then you don't spend a lot of quality time for that person. So where is that person in reality to where he wants to be? Right? Yeah. So it's insurance's fault, and people always brag like, oh, I have good insurance. Like my insurance is good. Do you really? Like, do you really have good insurance? Are they really taking care of you, or you're paying a high premium and you think you have a good insurance and you're getting shafted?
Yeah, you know, like, and then the premium they're paying, I mean, that could easily go to just paying you, just have regular insurance, I guess, and everything.
Yeah, and then the other thing too is like insurances, they have an out-of-network benefits, right? So if you were to come and see me, at the end of all your physical therapy sessions, I give you an invoice. You take that to your insurance, and if you have out-of-network benefits, they give you a percentage back. Yeah, they reimburse it or apply it to your deductible. So why not? Why not get better care, get better faster, and then you go there. Like, I get people now, Joaquin, like I don't get people that looked for me first. I get people that look for me last. And people that didn't get better by going to other people, they're like, well, let's give this guy, and I'm in a basement. Like I'm in a basement, 500 square feet. I have a squat rack. I have everything I need. And like people walk down and they're like, what the F am I doing here? Like, what is this place? You know, like, but at the end of the day, like the care they're getting is way better than they're going to get any other place.
Yeah. Man,
and I back that up because I know what I provide. And for me, I think a big thing that I've been told is like, you grew a practice and you started it during COVID, during a pandemic, during a recession, you know, so to me, that's even more motivating to make it grow and to help.
Yeah. Do you know how much more will it grow after COVID?
Yeah.
So you're still seeing patients even during this whole thing and everything?
Yeah.
Masks, I guess, all that stuff.
Yeah. So masks, spray down everything after they're done, clean equipment. But you know, I mean, the revolving door of patients coming is very low. Like, lately I've been seeing like 7 or 8 a day, because I see an hour a day, but typically a busy day is like 5 or 6. But in reality, I put so much effort into every patient and they're paying for it that's very busy for me. And then I offer everything from like, so I'm a fellow, so the fellowship is in manual therapy. So I can basically like pop bones, crack necks, all that kind of stuff. Like, so that's what I did, 3 years of additional training. And then I went and got certifications in like dry needling. So I needle people if I feel like they need it.
Oh wow, you can do all that stuff too?
So I do barbell rehab.
What does that mean?
Do,
What does that mean? Like
Acupuncture, right?
that, so it's the same. So it's the same needles as acupuncture, but dry needling is more like I guess like more Western medicine. So what you're doing is typically, I mean, some people will say dry needling is a sham. Some people say it's great. I say if it gets someone better, why not do it, right? But typically, whenever you have like a chronic injury, like let's say you, George, you have chronic back pain, it's been bothering you forever because you never saw your friend Edwin.
Doctor Ed.
So typically, what will happen is when your body is like chronically in pain, you have like your body at some point failed to heal itself, right? So and it's not that it didn't heal itself; it could have healed, but you're very sensitive still to that area for whatever reason. So what I do with dry needling is I stick a couple needles in your back to really, what it does, it creates micro trauma, right? So anytime you have like a cut in your skin, your body prioritizes that to heal, right? So what I do by sticking a couple needles in you, it says like, oh, there's trauma in the area. Let's take more blood flow into the area. Let's let it heal. It's kind of like hitting like a reset button so that it prioritizes the healing in that aspect. So that's something that I do there. I dry needle, I supplement that with manual therapy. But at the end of the day, man, like manual therapy and dry
That's
needling.
not like acupuncture, like the way they do that.
So, so acupuncture is like prime meridians, like they go off of your chi, right? Like your prime meridians down your trail, like they'll put like needles down. I go more like muscular, like, okay, where's the muscle belly to this? And then I go there. So basically that's what you're doing with dry needling is you're creating like an inflammatory response to the area to allow for more healing to take place. And some people will say, oh, it's a placebo effect. Some people say, no, it's not. But if it gets someone better, like why not incorporate it into what I do?
How do you feel about the suction cups?
Cupping? It's the same thing.
No. Now what you do in your private time, but you know what?
The suction cup is cupping. So it's the same concept. It's supposed to increase blood flow. I think anything like that, whether it be like cupping, whether it be kinesio taping, whether it be anything, like if it helps you feel better, why would I not do it? There's no reason for me not to do it. A lot of people on the research world will say like, oh, it doesn't do anything. It's only a placebo effect. But if it helps you feel better, why the not? Like I think everything that you do is about belief. Like there's so much, everybody attributes pain to something physically wrong, but a lot of it is mental. And if you go into like pain science, like your pain does not come from an injured structure in your body. Your pain comes from your brain, right? Like think about like there's a big like analogy of like, think about you running across the street, you sprain your ankle, and there's a bus that's about to run you over. Are you going to feel that sprained ankle? Probably not. Like you're going to run to save your life before you get run over. So your body knows what to prioritize. Also, pain so it's produced by your brain, and then when it's produced by the brain, there's a symptom magnification. So pain is also made worse or better by how you eat, how you sleep, how you recover, right? If you're not sleeping well, if you're not recovering well, if you're eating like crap, then your pain experience is going to be a lot higher. Also, if there's a big catastrophic event, let's say you hurt your back, but then someone in your family that you're close to passes away, that pain experience is so much higher, right? Because there's so much going on that you have symptom magnification. So at the end of the day, that's why what I do a lot is education and teach people, because what I'm telling them, I don't just tell them physically this is wrong with you. I tell them like, like I use a car analogy, like that back that you have right now has been in pain for so long, that's what it knows. So we need to slowly get it moving in different directions without increasing your pain to know that your body is okay. So think about two cars, and I always use this analogy, but use about two cars, same model. One car, the alarm is so sensitive, if you drive by it, it blares. One, you could hit it with a hammer and it doesn't blare. So our goal is to get your alarm to like that car. And so where you're not sensitive to it, because that's where the imaging question we went into earlier, Joaquin, where like you can get imaging and like a doctor would be like, oh, you have two herniated discs at L4, L5. Well, like all of us have herniated discs at L4, L5. Like all of
I
us.
have
But
it at
why do some of
L6.
us? But why do? But there's no L6.
I don't. Okay.
But but like why like so why do I have pain and you don't? So what is your pain experience compared to mine? So a lot of it too is psychologically, psychosocially, what is going on within us that allows us to get rid of pain. And physical activity helps with pain. So at the end of the day, I supplement my manual skills, popping backs, popping necks, mobilizing shoulders, mobilizing ankles to get you moving better and for your sensitivity to decrease. But at the end of the day, what's going to get us better is specific exercise tailored to what you need.
Nice.
Mm-hmm.
Hey, bro. So, and I don't know if this is a dumb question or not, but
It is. It is.
well, then screw it. I'm gonna ask it anyways.
Well, then I feel
Can-
like I've asked more dumb questions this podcast than
Than
any
ever
other
before.
podcast.
Nah, bro.
We're
But can anyone go in, like, even if they don't have a pain or anything, but they just feel like, hey, I'm getting older. I just want to make sure that
Yeah.
I'm doing everything
Yeah.
right. Can you still help them? I guess
Mm-hmm.
like going a car, you just want to tune up, or you just want to make sure everything's running good.
Yeah.
Can they still go
Yeah.
into
Yeah.
your place?
Yeah. So if you think about like again comparing insurance space versus non-insurance space, you go insurance space, you're done with PT, you're done. Like I'm sure you like when you were done your last day, you're like, well, what do I do now? Like, can I go to the
Yeah.
gym? Can I go running? Can I play basketball? Like,
Yeah.
so there's what
And
we
I
call
was
like
scared, and I
continuous.
was scared sometimes to like do
Yeah.
stuff, but little by little, like, all right, cool, but
Yeah. But you could have probably gotten there faster too, like to where you feel more confident with your knee, So the basically what you're doing is like like today, for example, I finished with a patient. It was like, hey, like you finished 7 sessions with me, you're good, you have no pain, you squat without pain, you run, you do everything. I was like, your body's like a car. It's like a car. You change oil regularly, you do maintenance, you change the tires, you do all this. I was like, sometimes you need maintenance. If you do, just call me. Like, don't let your pain get bad, and just come in for one session every couple months, every 6 weeks, and
nice.
really get assessed and see what's going on. Because also what I do is I provide an assessment of like muscle imbalances. Like, this is what's wrong
Nice.
with you. So like you should work on strengthening this so that you don't come up with issues later on.
You don't just tell them you're a weak ass motherfucker. You don't just tell them.
I tell them that on the first day.
George, you weak, bro. You're weak.
And then certain people.
Well, you know
like,
what? You know
and-
what? That's actually a thing that happened to me. Like, so there was a point where I was like, look, my back is like horrible. Like, it's messed up. I need some kind of thing. And so I needed surgery. Like, they were gonna go in and
clean it out.
one of the L's was messed up or bulging, and they were gonna shave it down. And I get it, but the only reason I didn't do it, and it's probably stupid to say or whatever, but they said I could never ride a roller coaster again.
Is that true?
Yeah.
No, Edwin. Is that true?
I don't know, but I'm laughing at the fact that that's the only reason why you didn't get it.
That's true.
Well, I'm gonna tell you why I didn't do it, but
Okay.
yeah, that was the thing. Because like, you can never ride a roller coaster again. But I was getting ready to have a kid. And
Yeah.
I
want to spend time with your kid.
I want to at least ride one roller coaster with my kid.
Mm-hmm.
And so that was the only reason. I was like, I'd rather hurt than never ride a roller coaster with my kid. Like,
Yeah.
I want to have that experience, and I want him to have that experience. I remember riding my first roller coaster with my dad, and I want my kid to have that same experience. So when I was told I couldn't, I was like, no, I'm not gonna. I'd rather get hurt before I deny that.
No, I mean, honestly, I think your kid saved your life. Like, I think you like wanting to be able to ride a roller coaster with your kid, and them telling you like you can't ride a roller coaster ever again, like saved your life because surgery is not guaranteed that you're gonna come out and not have pain.
Yeah.
Like it's there's no guarantee, and you're still so young. Like why? Back surgery at the end of the day can be way more debilitating than not having surgery. And so there's like different ways and avenues to get better. It's just a matter of finding the right person to take care of you. Like, and then that's anybody listening to this podcast. It's like, Like if you need to demand more from your healthcare provider and advocate for yourself so that you can get better. And surgery is not always the answer. Our bodies are very miraculous. Like they heal, and they're meant to heal. And if you modify things and you do things appropriately, your body will heal. A herniated disc, if that is truly what is going on with you, because like I said, an imaging, yeah, that'll come out, but maybe you're having other imbalances that you don't know about. At the end of the day, though, a herniated disc, the reason why they bother you so long is they take 300 days to heal. 300 days, almost a year. So if you don't have the patience to get your back to heal and you're looking for a quick out, surgery is not always the answer. Like you got to look at normal healing times of the human body to know that, hey, this is normal. Like I was dealing with a patient the other day that had a stress fracture in her toe, in her big toe. And one would think like big toe, like, oh my God, whatever. But big toe takes on a lot of force. You run off of it, you push off of it. And, you know, she was 2 months down the road and she would go see her podiatrist and she's like, yeah, you know, he thinks this is going on, this is that. And I had to show her my book for my fellowship. It was like, look at this timeline. Look at where you're at as far as a fracture and look how long it takes to heal. After her fracture, she was only 6 weeks or 8 weeks out. It takes like 12 to 16 weeks sometimes to heal. Like, we're not going to get better right away. Like, it's not how it works. But sometimes what we want as people, we think that how we got there overnight. Like, your back pain, George, didn't start overnight. You did things that led to that point that got you in pain. So it's only normal for you to do things that take a long period of time to get back to where you have no pain. You know, like that is something that we have to cognitively understand as people, is that we don't heal as quick as we injure ourselves. Today I saw someone with a back pain and he's a friend of mine and he bent over and fixed his boot and he couldn't get up. Like, but it wasn't that. Like, I feel like if you're going to bend over to pick up a piece of paper, like, you don't need proper form to bend over and pick up a piece of paper. Like, you should be able to fucking bend over and pick up a piece of paper, like, without even thinking about it. So was it him bending over to fix his boot? No, it was, I looked back. It's like, did you change anything? You lift weights. Did you train differently? Did you do this? Oh yeah, I did a new program. It's more core this way. It's more offsetting, blah, blah. I was like, this is probably what flared it up, but it'll get better. And the thing that he did is his back hurt this morning. He says, do you have availability today? I didn't, but I saw him at 5 o'clock. And I saw him at 5 o'clock, and then I got him better, and he walked out much better. But then if he would have gone the other route, which is a more traditional, like, wait, go to doctor, ibuprofen, blah, blah, like, his pain at that point gets a lot worse. Whereas you get some guidance right off the bat, and you get better. What we need to do is retrain that, and maybe we can't bend 100% right now, but maybe we can bend 25%. And we start there, and we bend you slowly, and you bend at 25%, then you bend at 50, then you bend at 75, then you bend at 100, and that may have taken us 8 weeks, but hey, now you can bend without pain, and now you can do the things that you want to do, and now you can ride a roller coaster with your son.
Nice.
Yeah.
And with that said, Edwin, I'm gonna have to go with you. Hey,
yeah,
bro, that way you can ride a roller coaster, dude.
I'll take care of you. I back what I do, and I back my products because I do the best for people. I didn't get into this to make more money, although I am making more money than I was before. But, you know, my goal was never to make more money. It's to help people. And that's really why I got into this. You can do both. Why not, right?
All right, bro. Hey, is there a too hard, too fast a story you have that you want to share with the people? Whatever you feel comfortable with. Sometime, man, you just got drunk real fast, and you just had a crazy story or something. Whatever you feel comfortable saying.
Too hard, too fast. Let me see. When did I go too hard,
too fast moment? Or yeah, it could just be a moment. It's all good.
Too many times. I remember being in Italy.
I feel you, bro.
No, I remember being in Italy. I was a 22-year-old. My roommate has just turned 21, but the drinking age in Italy is 18, but we still celebrate his 21st birthday like he could drink.
Nice.
So we went that night, and we each drank 21 Irish car bombs, and we had to carry him home. Yeah, and then that was like, I mean, this guy was like on the cobblestone in Florence, like his head hitting all the place, carrying him and everything.
What better place, dude?
That's my too hard, too fast story right there. That's
hell yeah,
what I
dude.
can think about right now.
Shit, that was me though in Rome though. People had to carry me out, bro.
Yeah, because they thought you were jacking people out.
Yeah, shit. No, I was just drunk.
Taking
Bro.
people their money. Yeah.
No,
He's a gypsy. Take him out.
yeah. But hey, bro.
No,
So,
he's
but
not.
close out, bro. People who are inspired to
Mhm.
get in the field. What recommendations you have, and what you got for me?
I think like anything you do, not only this field, but I think you got to take it one step at a time, one day at a time. It's going to be hard. It's not easy. Like to this day, I feel like starting my own business, it's a little difficult. A lot of trials and tribulations. Also, like running it with my wife. You know, there's times that we want to kill each other, but then we love each other at the end of the day. I think as long as you keep pushing forward and like one step at a time, you're going to get to where you need to get to. If you think about the end point and never take action, you're never going to get there. But if you think about what's the first step and then what's the next step after that, until you get to your point, you're going to be fine. And then for anyone dealing with like pain or discomfort, I mean, I'm in the San Antonio area. If you've been through many failures, I encourage you to give me a shot. I'm only here to help people, not here to take your money. Although I have to keep the doors open somehow.
Yeah.
So
Where do they find you?
Yeah, so located in the Southtown area, so it's pretty central. People drive all the way from the Dominion to see me now, and like say it's like a 27-minute drive. So if people can drive from out there to come see me anywhere in San Antonio, you can drive down. And like I said, it doesn't take a lot of time out of your day. It's usually once a week. Sometimes we feel like we need more. Sometimes it can be twice a week. But the care that you will get will be a lot better than you've probably had in the past. And then we do everything through Instagram right now. Our Instagram is positiveaction_PT. And then our website is positiveactionpt.com. If you want me to directly call you, there's a link on there that says talk to the doctor. And you basically fill that out, it gives me a brief history of what's going on with you, and I give you a call and see what's going on and how I can help you. And I can tell you right off the bat if you're a good fit for me. If you're not, for whatever reason, I can refer you to someone else or get you better care somewhere. Mm-hmm.
Nice.
Yeah, that's honorable. Now, tell us your OnlyFans page.
My OnlyFans page is Dr. Pepper, Dr. Serrano Pepper.
Hey, that would have been if you did have an OnlyFans page. That would be the page.
Dr. Pepper.
Dr. Serrano Pepper.
Dr. Serrano Pepper.
Edwin, I really appreciate that you gave me the time for this podcast.
Yeah, I appreciate y'all having me on.
I appreciate our friendship, everything we've had
Yes, sir.
together. With that said, another podcast down the drain.
Hell yeah.
Worm, what are you going to say?
Dr. Serrano, Southtown, San Antonio, Positive Action PT. Go fix yourself.
Go fix yourself.
Nice.
There should be a shirt, man. That should be a shirt.
Make that your slogan.
Go fix
Go
yourself.
Fix yourself. Hey, I like that. Like hashtag go fix yourself.
Hell yeah, man.
Yeah, I like that.
You heard it here
I'm gonna start
first.
doing it. Thanks to Joaquin.
Go fix yourself.
Go fix
You're
yourself.
welcome, bro.
Well, you already gave
Hey, just give me 2 free sessions, bro. That's all I want.
So at that point, like we came up with it, so the podcast has a cut on the
We
commission.
have royalties.
But
Hey,
with
for
that
real,
said,
though,
another
use that, bro.
podcast-
Go fix yourself. I like that. Use it.
But with that said,
Positive
another
Action
podcast down the
PT.
drain.
Go fix
Worm,
yourself.
let me close this
Hell
podcast.
no.
Another podcast down the drain. Thank you very much. Remember, we're trying to get to our 100 subscribers. Help us out. Subscribe, like, and bye.
Go fix yourself.